weeks, Randall Burnham thought he had the flu. Instead, it was a type of deadly leukemia.
When I was diagnosed, I was actually so sick, I didn't really understand what was going on. Afterwards, they said that I was within a couple of days of dying.
Burnham was diagnosed with acute myeloid leukemia, a cancer of the blood and bone marrow that spreads so rapidly that unless a patient gets treatment, he usually only has a matter of months to live. Chemotherapy is used to put the patient into remission.
In other words, the bone marrow and the blood have been restored to a normal-looking state.
Dr. John Kareth says chemotherapy does not kill every cancer cell. In some patients, the cancer recurs.
And I noticed a couple of days ago that it was like, oh, I don't feel as achy as I did before.
Good.
Dr. Kareth says a simple chromosome test shows whether the patient has a good, poor, or intermediate chance of acute myeloid leukemia returning.
I think that sounds pretty good, actually.
For those with a good prognosis, chemotherapy alone may suffice. For patients with a poor outlook, chemotherapy plus a blood stem cell transplant from a donor is the usual treatment. But there was no consensus on how to treat patients in the intermediate group, who have almost a 50% chance of recurrence.
For intermediate risk, no one, even the experts, were stumped.
Dr. Kareth and other researchers analyzed data from 24 studies. They noticed that healthy stem cells from a compatible donor helped boost the survival rates of patients who had intermediate risk. Randall Burnham found a good match.
I had a sister with a perfect match to me, and then a brother and another sister that had slight deviation. So they took the sister that had this perfect match, and she was the one that donated the stem cells to me.
Burnham has been in remission for 2 years after having the transplant. Dr. Kareth says the study may provide clear direction on how intermediate risk patients should be treated. There are risks associated with the transplant procedure. Burnham takes precautions because he is more susceptible to infections and other side effects. But Dr. Kareth says the treatment's benefits outweigh the risks. The study has been published in the Journal of the American Medical Association. Carol Pearson, VOA News.